Let's say that the idiopathic aplastic anemia field, after many decades of therapeutic impasse with only few strategies approved, including immunosuppressive therapy with ATG and cyclosporine or androgens, besides transplant approaches, in the last decade has seen the approval of Eltrombopag, a TPO agonist, first in the refractory setting, and then in addition to standard immune suppression with the results of the phase 3 randomized race trial that has been published on the New England Journal of Medicine 2022, and clearly showed the advantage of the triple therapy with Eltrombopag plus ATG and cyclosporine, representing a true breakthrough for patients with severe aplastic anemia as upfront strategy. So since then, other TPO agonists such as romiplastin, avatrombopag, or also etrombopag are also in study, in particular for patients with refractory or relapsed aplastic anemia. And other approaches that have been proposed for the refractory relapsed setting concern the JAK2 inhibitor Ruxolitinib, or also interleukin-2 monoclonal antibodies that are now under investigation in phase 1-2 trials, especially in the United States. Of course, besides pharmacological intervention, transplant-related strategies continue to improve, with several protocols all over the world investigating the role of alternative donors, including haploidentical and mismatched related donor transplants for patients with severe aplastic anemia, especially in the refractory relapsed setting, or also matched related donors as upfront approaches, in particular in pediatric population. The problem is that many patients remain non-transplant eligible or do not have a suitable donor, and their clinically, the context of the failure of intensive immune suppression remain associated with dismal outcomes. So it is encouraged to include this category of patients in clinical trials whenever possible. And we have now other strategies never considered before that seem to be of interest in this setting, and we are confident that the research in this direction will improve the management of these patients.